Hi, I'm Denise Duclos, the President of the Dystonia Network of Australia. With me, I have Lorraine McAnally, our Secretary. The Dystonia Network of Australia, or DNA for short, is a registered charity and the peak body in Australia for people with all forms of dystonia.
We're here with Dr. Alex Notman, who's a clinical neuropsychologist and also a member of our advisory board. Alex, can you tell us a bit about yourself?
Sure. I am a neuropsychologist. I've been a neuropsychologist for more than 20 years. I have an undergrad psychology degree, a master's in clinical neuropsychology, and I have a PhD. I work at the War Memorial Hospital, which is a public hospital in Waverley in Sydney's east. And I also work in a private neuropsychology clinic called Focus Neuropsychology.
Okay, great. Alex, could you tell us what is neuropsychology? What are the types of things that you actually do?
Okay, so neuropsychology is a specialist branch of psychology concerned with assessing and treating the effects of different brain conditions. And so the conditions that we're talking about might be neurological condition, ranging from dystonia to stroke or brain injury or dementia. And there can be other conditions as well, like psychiatric conditions or neurodevelopmental conditions like ADHD. But basically, what we're interested in is looking to see how these conditions can affect thinking skills like attention, memory, problem solving, etc. And also how they can affect emotional status and also how they might affect behavior, like impulse control, for example. And so what neuropsychologists do is they assess and try to treat these issues that people can present with. Would you like to know what happens when you come to see a neuropsychologist?
Love to.
Because there are not many of us around, and it can be a little bit of a mystery, but it's not that scary. The way it works is you come and you take part in an interview, and the neuropsychologist will ask you questions to get a bit of an idea about your personal background, mental health history, medical history, and what's bothering you, what's changed, and what problems are you coming with. And then the neuropsychologist will administer a number of different tests, looking at things like your memory and learning and problem solving. These tests, most people find them very interesting. The assessment can go for a couple of hours. And there are a range of different tasks, pencil and paper tasks, computerized tasks, verbal tasks, puzzles. Some of them are easy, some of them are more challenging. And the idea is to find out what a person's strengths are and any weaknesses they might have, and what we can do to try to improve those abilities.
Alex, how is neuropsychology different to neuropsychiatry?
It's a good question. Whilst they are very different professions, neuropsychologists and neuropsychiatrists do collaborate, work together, but there is a clear difference. Neuropsychologists are trained psychologists who treat people with psychological, cognitive, behavioral intervention, whereas neuropsychiatrists are trained medical practitioners with neurology and psychiatry training who treat people with medical interventions and medicine.
Right. What are the reasons, say, a person with dystonia may see a neuropsychologist?
Yeah, okay. That's a good question. That is a good question. There are a number of reasons that someone with dystonia might come to see a neuropsychologist. The main one, I imagine, would be for a cognitive assessment. So to have a look, to evaluate thinking skills, work out what a person's strengths and weaknesses might be, yeah, for a cognitive assessment, which can actually be really helpful. A lot of people think that neuropsychologists are just there to find problems, but actually we work with strengths as well. And that can be very reassuring for many people. Second reason is related to that, and that is the cognitive rehabilitation. So that is to give people strategies and advice to improve their thinking skills. You might come and see a neuropsychologist for some emotional support, to manage issues like anxiety or depression or frustration with living with dystonia. Or some neuropsychologists are involved with behavioral intervention as well. So to teach people strategies to manage behavioral issues. And then I guess another reason might be in a hospital setting, you might see a neuropsychologist as part of a deep brain stimulation workup. So you might see a neuropsychologist before the surgery and then perhaps after the surgery as well.
Mm-hmm.
So you really also, you've answered how are you able to help anyway. So obviously, I'm going to hand on to Denise.
Alex, stress can make dystonia symptoms worse. What are the sorts of things that people with dystonia can do in situations where they're impacted by stress?
Okay. There's no sort of it's difficult to prescribe somebody something to do for stress because everybody is so different. Everybody has a different reaction to stressful conditions, and what might work for one person might not work for another person. And I do have a number of suggestions, which I'll go through. I think it's always worthwhile giving these a go, to experimenting. They do work for many people, but if these don't work, it's always a good idea to chat with your GP, to look at maybe seeing a psychologist or psychiatrist for specialist help if these things don't work. But there are a number of things that we can do to reduce stress, and they range from maybe breathing exercises, deep breathing exercises to calm the nervous system. You might consider mindfulness therapy, so mindfulness meditation, which is focusing on the present to try to reduce those anxious thoughts and reduce stress. You might consider progressive muscle relaxation, which is the technique where you tense and then relax different muscles through your body, and that can reduce a lot of body tension. Could go for a walk, get some exercise. People, that social connection, catching up with a friend, talking with somebody, going out for a tea or a coffee. I guess it's also important to remember we should make time in our busy schedule for ourselves sometime. So prioritizing self-care and trying some of these things that I've mentioned. Aromatherapy, perhaps, journaling, writing things down. There are a range of different techniques, range of different strategies. Try them, see how you go. And if they don't work, get specialist help.
Great suggestions.
How do people get referred to a neuropsychologist?
Usually it's via a doctor. It could be a GP or it could be a specialist, but some neuropsychologists don't require a referral and you can approach them directly. Yeah. Referrals are always a good idea because they come with some background information and medical history, which is particularly important. But sometimes you don't need a referral to see somebody.
Okay. Well, Alex, we'd like to thank you so much for taking part in this interview. and providing us with such a wealth of information and knowledge. Thank you very much.
You're very welcome.
Thanks, Alex. And if anybody would like to know more about dystonia and the support that's available, you can go to our website, www.dystonia.org.au, and please feel free to check out the other videos on our YouTube channel.